Good afternoon, everyone. My name is Ava Wilson. I am the co-founder of PROTUS Health and Medical Manufacturing Solutions, and I'll be presenting to you my presentation, Revitalizing Healthcare Systems Across African Nations, a Commercial Enterprise and Community Project. Before I continue, I would like to thank the University of Bradford for hosting us, the African International Conference for making this wonderful event, and everyone who came all across the nation, and of course coming from Africa itself. So let's continue. And so what is PROTUS? What do we do? We are a bespoke healthcare consultancy company. We collaborate with public and private sectors to develop and implement tailor-made and innovative solutions to our clients' healthcare needs. What do we want to accomplish? We are more than a commercial enterprise. We are a socioeconomic and anthropological project to connect Africa and the diaspora. So for the remaining of the presentation, it will be in three parts: PROTUS as a commercial enterprise, PROTUS as a social enterprise, and finally a real-life application of our company. So what are our missions? We are here to revitalize healthcare systems across African nations, and we're also here to accelerate the localized support and localized manufacturing. So revitalize, of course, it means like to bring new life into something, and accelerate, it means to hasten. So we must understand that African nations are already doing their part with the resources that they have. So we're not here to take over, we're not here to say we know better than you, we're here to provide that support, those resources, that knowledge to help accelerate what African nations are already doing. In regards to revitalizing, it means that there's so much local knowledge, there's so much traditional knowledge, rich knowledge that's already there in Africa. So it's taking the best of both worlds, taking the best from the West, taking the best from local knowledge, and implementing a new system that can facilitate itself. So our initial goal is to create to help develop self-sustainable nations, and we do that in 4 ways. We provide education in healthcare and science-related fields via our apprenticeship programs. So those include like nursing assistant, dental assistant, technical support. And we also upskill registered clinicians, such as doctors, dentists. We do apprenticeships in local medical manufacturing, and finally, of course, to increase the employment and local expertise. As African people, we know that many times new regulations may not be what we actually need. So how do we know that what PROTUS is offering is what these African nations actually need? So, and also the diaspora as well. So 80% of non-pharmaceutical goods are imported. So stuff like gloves, aprons, these things are heavily imported into African nations. So our solution is, again, apprenticeship programs of medical manufacturing that start off with low and mid-tech goods, with that's on a 2-year plan up to a 15-year plan where nations will manufacture high-tech goods like MRIs and ultrasounds. And some people may think, well, 15 years is a long time. Well, this is a highly specialized skill that must be taken step by step. If someone tells you, oh, you can build an MRI in 5 years, I would not trust that person, okay? And next, the next 2 things, major problems in African nations, is that there is a major shortage of healthcare professionals, and also limitations to rural areas. So I wrote some statistics regarding shortage of healthcare professionals. So African nations represent only 3% of the global healthcare workforce, okay? And so there is 1 doctor per 3,000 patients on average, so very, very low. And also it's very difficult to reach rural areas, okay? So what is PROTUS' solution? We have apprenticeship programs in entry-level roles. And we also, once again, develop our registered clinicians, okay? And also partnerships with ministries of health to help facilitate knowledge base in the youth, and to also help facilitate local support as well. So for example, local birthing clinics. So the bare minimum, not to say bare minimum, but the basic care, so that at least rural areas can receive that type of support. And then another major problem in African nations as a whole is that nations need help in developing and promoting their own innovative healthcare practices. As I said, in regards to local knowledge, and not only that, there's so much innovation happening in Africa. For example, you have Mr. Arthur Tang. He is a Cameroonian, and he has created innovative technology for a touchscreen heart tablet, okay? Then we have another person, Mr. Conrad Tanku, who just so happens to be Cameroonian, and he has created a platform to remotely screen and diagnose breast cancer. So there's so much local talent in Africa already. So once again, we will also create partnerships that's going to target the youth, that's going to target that localized creativity and help develop what's already there. So once again, it's on a two-year process, two-year basis minimum. The first is, once again, we collaborate with private and public sectors to create tailored solutions. When necessary, we also provide exportation, installation, and service support. So in specific regards to exportation, when it comes to medical devices, most nations already have their manufacturing agent who they can go directly to, or wholesaler. However, when it comes to dental, vision, and audiology products, these are all private. So actually, PROTUS, we already have a deal with a dental wholesaler already. So we already have many things in place to support our clients. The next step also is, then after that, we will do training and apprenticeships, again in medical manufacturing, dental, assistant, other entry-level positions, and also upskilling our registered clinicians. And finally, we will conduct regular audits to ensure that the new implemented plans are being practiced and to retrain when necessary. So again, that's our two-year plan for any nation or any private sector who would like to work with us. Now we will go on to what we're doing as a socioeconomic and anthropological project. So who's behind PROTUS? Clearly that's me, and that's my brother. And so my background is very multidisciplinary. I was a teacher, have a bachelor's in anthropology, master's in phonetics, healthcare. I did academic research, so very multidisciplinary. My brother, he's very big on history. He is the lead intelligence analyst, and he's worked in many healthcare positions as well. And actually I have as well. I've done decontamination. He's done housekeeping, he's done dietary in care homes and hospitals. So we have a wide range of professional knowledge as well as personal knowledge from our parents and our sisters who were also healthcare assistants, and we would work with them. So we have an understanding of the healthcare system both professionally and once again kind of as like a volunteer role. So why did we create PROTUS? We deeply care for our African people, and most of all, well, that's most important, and then next is that we want to be the driving force that brings Africa and the diaspora to the forefront of healthcare. So again, African nations, African Americans, Afro-Caribbean, there's so much talent, and at the same time, there's so much disparity as well. So some more reasons why we created PROTUS. Again, we have the passion for healthcare and education. We've observed there's shared inequalities for both Africa and the diaspora when it comes to healthcare and education. So let me give you some statistics on like African Americans, for example. 63% of African Americans have less access to care. Caribbean nations such as Jamaica, St. Lucia, and St. Kitts and Nevis fall below the nursing density line that's supposed to be allowed. And 5% of African Americans are physicians in the US. So once again, out of the entire physicians and surgeons, African Americans only make 5%. In regards to the Caribbean, there is a high shortage of midwifery, and also in Africa, there is approximately 5 million healthcare shortages in the continent of Africa. So once again, these are shared healthcare inequalities that people of African and African descent face. Also, another thing that we've noticed is that there are so many African nations who are actually inviting African Americans and Afro-Caribbean people through all type of immigration schemes. So some of these nations include South Africa, Egypt, Nigeria, some of these nations, I didn't get a chance to write that down, but I know for certain you have Ghana, you have Zimbabwe, you have Kenya, I believe, as well, who are once again offering immigration status to African Americans and Afro-Caribbean people. But the issue is that as African descendants who haven't been to the continent in 500 years, how do we get there? Do we just pick a random nation and go? It's very difficult. And once again, there is also a major economic disparity across Africa and the diaspora. So how do we just randomly, even though these immigration schemes are being offered to us, how do we just randomly go there? So once again, these are some observations that we found and what helped develop PROTUS. So once again, we're just going to analyze what are the problems, the socioeconomic and anthropological problems facing Africans and African Americans and Afro-Caribbean people, and how does PROTUS solve them. So again, there are major healthcare disparities across Africa and the diaspora, and we solve that with home bases that facilitate knowledge, skill, and expertise. African nations have settlement schemes for the diaspora, but again, economic issues and lack of knowledge keeps many diaspora people away from going for these immigration schemes. So again, a solution is that we export Afro-Caribbean and Afro-American talent to the continent to facilitate programs. And then there can be a trade-off between these two groups where knowledge is shared and interchanged. And finally, there are education inequalities across Africa, US, and the Caribbean. So once again, as I said before, there's much talent across Africa and the diaspora. So we want to extract that talent for mentorship and to interchange knowledge. And now finally, PROTUS and application. We have been invited to Burkina Faso and we'll be going there this summer. So what are we doing right now? What is a real life example of how we're going to help secure this deal, but most of all, how are we going to help the people of Burkina Faso? So right now, my brother, he is aggressively researching the current cultural and political issues facing the nation. Some people may wonder, well, why is culture important? Well, we cannot just take NHS and put it in Burkina Faso. We cannot just take American privatized healthcare and put it in Burkina Faso. We have to look at, again, what is the local knowledge? What are these people doing that's actually working? What are they doing that's not working, and go from there? Political issues is not about is who a bad guy, or it's not about if we agree or disagree with him. We have to worry about trading. We have to worry about which nations can work with each other. So that's why we're looking at the politics of it. We're looking at the history that helped result in Burkina Faso's current healthcare state, and to make sure we avoid those incidents in the future. My brother, he's looking at the most deprived areas that need urgent care and the most pervasive conditions affecting the citizens. So once again, we can know to tackle these regions first and these conditions first. And my brother is also researching the most suitable places to build manufacturing plants. As for me, I am liaising with the NHS, manufacturers, and private healthcare sectors to donate medical goods, to train teams in peripheral areas. That means teams that probably cannot, regions that maybe cannot afford our services. We do have we're creating a charity to help facilitate for those regions and those nations, so everyone can get that support. We are attending conferences such as these and other, we are attending conferences to discover innovative healthcare goods that can help benefit Burkina Faso. For example, when I attended Surge Tech 2025, and we are networking with partners and manufacturers to build plants in Burkina Faso. As a whole, my brother and I, we are building our presence in Burkina Faso and the diaspora and Africa as a whole via social media. We are gaining connections with the local Burkina Faso people in the UK. And we are attending conferences such as these, as well as a peaceful protest in London, again, to show our support for the nation that wants to change. So that's what it's all about. It's about the people. Politics aside, everyone needs good health care, no matter who is the president, and whether you agree with him or not. And once again, as I said before, we've already partnered with a dental wholesaler who is ready to provide supplies for Burkina Faso and other nations. So in conclusion, PROTUS is here to revitalize healthcare systems, and we are here to connect Africa and the diaspora. We do this by collaborating with public and private sectors to develop and implement tailor-made solutions. We provide apprenticeships in entry-level healthcare and also non-clinical positions, and we train and we upskill registered clinicians, and finally apprenticeships in local manufacturing. And how do we connect Africa and the diaspora? We export local talent. We export Afro-Caribbean and Afro-American talent to the continent to facilitate programs. And sorry, Black British as well. Sorry about that. So any African diaspora. And then of course we are extracting local talent across the diaspora for Africa and the diaspora for mentorship. And finally, to recap, our goals are to support in developing self-sustaining African continent. The next goal is to connect Africa and the diaspora and to interchange talent between these two groups, and to improve the socioeconomic, healthcare, and education factors for Africa and the diaspora. If you are interested about learning more about us, if your nation needs dental exportation, we can facilitate that immediately for you. Or if you are interested in joining our team, because we need like healthcare managers, we need engineers, so we're trying to build a team of about 5 or 6. We also want to add a geologist to the team because we want to look at the local minerals inside each nation to help facilitate, okay, which products are best for them to manufacture. And if you are interested, you can contact us right here. And that is all. And if you have any questions.
Thank you so much.
Thank you.
So what we will call your base, +4 for UK, right?
Yes, I'm UK.
Okay.